Okay, my dear friends, our next panel is with some of our midwife professor and the team. Dr. Farzane Golboni, faculty member of Ministry Facebook of in Iran.
Thank you, Leila.
Thank you. Yeah, it's nice now. Thank you. Welcome.
Your voice is okay now.
Thank you. Good. We can continue.
First of all, I want to talk about some statistic about midwives in Iran.
Yeah, please.
Actually, I want to share our experience in Iran midwifery during COVID-19 pandemic and share valuable information between other countries' midwives to promote all caring, quality of care,
Go
mothers
ahead.
for babies around the world. We have more than 9,000 midwives in Iran, and in academic level, we have 700 more than 700 faculty members and 14 students of midwifery in all level of degree, BSc, MSc, and PhD in Iran. All of them involved in COVID-19 pandemic program, and all faculty members, professors answered moderate questions about their concern in 24 hours call centers. And the other settings, in private settings, we have more than 500 midwives in private settings, such as private office counseling centers, and they help care mothers and their babies who don't want to visit the PHC and governmental hospital during this pandemic because of their concern, you know. And the other settings, we have midwives workforce in hospitals. We have more than 17,000 midwives in all hospitals in Iran, in all wards such as maternal neonatal health ward, gynecological clinic, delivery room, postpartum gynecological ward, and neonatal and NICU wards, and midwifery triage. And they are at the midwives in all hospitals is the front file forefront of the COVID-19 disease. They help the healthy and sick mothers to have a safe delivery, safe breastfeedings during this pandemic, and then follow them after discharging in hospital. And the other settings, we have more than 15 midwives workforce in all settings of PHC levels, centers, in national COVID-19 pandemic program, midwife collaborating with other health providers to, for example, caring such as working 24 hours in PHC in all days and 16 hours in holiday, screening all mothers and the babies who suspicious with COVID-19 and refer them to a high level of settings for more assessment, following mothers with COVID-19 for breastfeeding, for all care, for all concern about baby health, and consult them that they need, the all need of mothers holding virtual educational classes for all mothers, to reduce stress and give them the care that they need. For example, some mothers have the concern and worrying about the baby's health and the future of pregnancies, and some of them want to start families and about relationship with her husbands and other things. So we have telephone counseling and midwives. Midwives collaborate with all another health providers in screening mothers and all people around Iran. 19% Iran screening for COVID-19 disease in all setting of PhD. We have call centers to answer all women and families concerned during pandemic. We made and shared some short films about mothers concerns that we found in call centers about their babies, pregnancies, and families. And then we shared this video to all mothers to know we have answer to all their concern. And we try our best to all care in this pandemic. So we want to say you, in this pandemic, we have good experience of team working with gynecologists and physicians and nurses and midwives. And all of them want to promote the mothers and babies health during this pandemic. Thank you so much. I finished my first PowerPoint information, but it's really hard to nothing have any PowerPoint and but remember what you want to say, you know. But because of the because we are in Ministry of Health, I had this as statistics, and I remember what I want to say to you and all friends. Thank you.
Thank you so much, Doctor. It was fantastic to people to know what's happening in Iran and how much is Iranian midwife role. I know it was so difficult without PowerPoint, and anyhow, we could get exactly the point that we were looking. It was a question from many midwives from all parts of the world. They want to hear that how Iranian midwife could manage this pandemic. We have a next presentation from you that is very interesting topic. And it is about caring, treatment and care of pandemic with Persian medicine.
Persian medicine, you know. Okay. No, I want to talk about some information about pregnancy care with Persian medicine. As you know, as a national medicine, Avicenna is the one person that who is very important in the medicine history. And in Iran, we have some office in one office in the Ministry of Health that that is Persian medicine. I work at Persian medicine office in Ministry of Health. So I have some information maybe useful for all people. It's not related to pregnancy just, but it's may useful for other people that share this information, may be useful, maybe reduce the pandemic, maybe reduce the morbidity of this pandemic during this day. But so we decided to share this information in this international webinar.
Thank you so much. It's so interesting topic.
Okay. We have general information, general recommendation in Persian medicine. All recommendation provided by World Health Organization, such as everything's avoid gathering people, crowds. That's okay. That's just according to the WHO recommendations. But more recommendations in Persian medicine, in national program in our office, that I want to share it with you. We have Persian medicine for COVID-19, which are this slide, some selected of recommendations of that plan. As we said, we have a national plan of Persian medicine for COVID-19. And some recommendation. Next one, Persian medicine recommendation to prevent COVID-19. You know, as a person, all things in Persian medicine, psychological, medical, and emotional things are related together, such as current medicine. But it's very important and projected in Persian medicine to prevent some disease, such as COVID-19. And in Kanun, Avicina's book, you know, we have some recommendation to empower our immune system against all disease. So I listed some recommendations, such as relaxing, avoiding stress, praying. It's very good. And okay, taking mother with her fetus. It's very important. Being happy and laughing, relaxing, breathing exercise, avoiding laziness and inactivity. Have a short exercise. Use natural fragrance such as rose water, citrus lemon aroma. It's good for prevent and empower our immune system. Avoid synthetic and spicy perfume. Spicy perfume may weaken our immune system. Avoid overeating expired food, canned food, okay, and fast food. Drink more warm liquid and avoid cold drink. And some point is very important, reduce dairy consumption. If, for example, one drink, you should add some masala and other things for reduce the problems. So in this pandemic, Persian medicine recommended reduce dairy consumption for all people. And other things, use black seed oil to lubricate nose, because when you lubricate your nose, in some of problems such as virus and microbian maybe attach into the nose, and we can clean it and don't let to go to the lung, you know. I don't know what to clear it for all of our friends. inhalation of warm water, which camulate. You know, inhalation warm water is very good for some disease, some lung disease. Herbal tea, liquoric powder is useful. But this is some recommendation for pregnancy and diabetic Persian and high blood pressure. They should they should have limitation in liquoric powder. Use fresh vegetables such as basil, mint, green, beans, squash, carrots, turnips, beets, but limiting fenugreek and celery for pregnant women. We have all recommendation, but limitation for pregnant women in this slide, but all recommendation for all people is useful. To empower the immune system using ginger, garlic, honey, and citrus. Increase your consumption of stews and watery soups. Unfortunately, in our hospital, we saw that for example, private hospital, they served some rices and chickens to COVID-19 disease. It's very, very harmful for all people with COVID-19 and all infectious disease to eat these foods, this type of foods. But increase consumption of soups and watery soups is very, very useful. I selected some problem in COVID-19, such as coughing, fever, and shortness of breath, and some recommendation for reduce these problems in Persian medicine. I wrote it to all our friends. Marigold and mountains are thyme herbal tea. Queen's fruit seeds dissolved a teaspoon of glass of boiling water every half an hour for 2 tablespoons drink a meal of its glaze. A teaspoon of viola flower syrup every 8 hours. It's very good for coughing. I tried. It's very, very, very good and useful. In fever, that's one of the more important part of COVID disease. A glass of apple juice every 6 hours, it's useful. It's not any concern to having much more 6 apple of juice because it's okay and it's safe for all pregnant and non-pregnant women. Putting feet in the willow distilled water, it's very useful for reduce the fever. Chicory fumaria extract with red sugar, marshmallow and violet flower herbal tea, chicken and barley soup, and coriander, and the willow extract. This is a very, very effective in reduce the patient's fever. For shortness of breath and COVID-19 patients, we can use mint extract for aromatherapy, inhalation some mints with hot water, for example, incense marshmallow extract, massage essential oil of mints on scapula. It's very useful. And finally, overall, all treatment in Persian medicine are complementary with current medical and chemical therapy and not should replace instead. You know, Persian medicine focus on prevent disease. and pregnant women should be considered as risk for this disease. Psychological and emotional support is essential for this prevention. Yadavi acts such as cupping, massage, and other things is useful. For example, we have one article about cupping in patients with low saturation, and we increase all saturation in Masih Daneshvari Hospital. 10 increase 10 saturation and more 10 or more saturation of O2 among people who suffer from COVID-19 and published in Lancet. It's very, very useful for all people around the world to know and share this valuable information about Persian medicine and another medicine that may
آنلاینم دارم اون رو نگاه میکنم جان
that may help other people around the world. Thank you so much for your attention. It's over, Leila, and my presentation, it's over.
Thank you so much. I hope I can.
Thank you so
yeah,
much.
It was so fantastic, doctor. Thank you so much.